Now, I would like to call upon stage Dr. Kishore Mehta. He's been a homeopathic physician since last 40 years. He is a founder member and ex-director of Homeopathic Education and Research Institute Mumbai since last 30 years. He was facilitated as Teachers of Teachers and honored for life achievements in homeopathy. He is also working on multiple sclerosis cases since last 5 years. Over to you, sir. Dr. Kishore Mehta. Have a big round of applause for Dr. Kishore Mehta.
Sir, before sir comes in, I would like to mention about him. He is what rightly mentioned. He is a teacher of the teachers. એટલે અમારા ટીચરના પણ ટીચર અને એના પણ ટીચર સર છે. અને સર has been in practice since 40 years, like Dr. Wahi sir is practicing since 56 years. હોમિયોપેથી આપણે જે હમણાં જાણીએ છીએ, પણ જ્યારે in 19 almost 70s, 80s, when you are homeopathy was not aware, and these people has lay the foundation of homeopathy જેનું આ fruits છે. So this is we should respect them. Kishore sir સાથે actually he has just recently visited Bulgaria. He is internationally giving seminars. અને એમની પાસેનું જે crux છે ને, I said sir कि sir you please attend all these sessions and you give your comments on these sessions too. Sir. अच्छा, मयूरी इज बिकमिंग हैप्पी कि सर आपके में टाइम लग गया. आइए आइए सर. वेलकम सर. थैंक यू.
Good afternoon, everybody. I hope you enjoyed. I must appreciate Dr. Shobha. If you really want to become a doctor who can represent the cases even in allopathic seminars, this type of presentation is necessary. You know, and everything she has given you. She has given you the cause of the disease, the personality of the person, the problem definition, problem resolution, plus investigations, and plus the manner in which the prescription was made of petroleum. In fact, she completed what Dr. Praveen left in terms of carbon, so petroleum. Wonderful. Thank you very much. Nice presentation. And every institution requires such teachers. That is very important. Only such teachers can bring up homeopathy. Okay. So, and in the previous all presentation, you could see the efficacy of homeopathic system of medicine in a deep pathology, you see. And not only that, how to bring about simillimum between the pathology and the materia medica. That is very important, you see. And it requires a circumspection of the patient's history, which I will also talk in my lecture. And something yesterday I was discussing with Dr. Bhaskar Bhatt about the prognostic criteria of homeopathic patients. Patient comes with whatever disease. Now in her case it was mycosis, no? In your case? Yeah. And many other cases were presented by this. Your prognosis should be not related with clinical condition. To be very careful about it. Most of us who are practicing homeopathy, हम लोग एलोपैथी की ओपिनियन ले रहे हैं और उन्होंने कहा कि भाई ये incurable है, आप जो करना है वो करो. We also consider it as incurable. That is our problem. Because such cases, what she showed you, otherwise was failure by other system of medicine, totally. And still homeopathy can do. So what is lacking in our making prognosis of the case? Why we consider that whatever has been opined by other system of medicine's champions, we should accept it. What is our way of looking at the case? She had shown you the approach to the case also. How she has approached to the case. How she has evolved the case. What is the evolutionary totality? It's a complete presentation of the case. And that is what every one of you, of course, what Dr. Praveen and other doctors have presented, that is of a higher level where you are giving your presentation to higher conferences, But as far as the students are concerned, Shobha is the ideal representative of that teacher about training the doctors, training the students. And once you get trained like her, you can easily understand what Dr. Praveen was talking or Dr. He gave before to the patient, Then you will be, and Dr. Mayuri, the way in which her presentation of neurodeficit diseases. One thing, keep it in mind, it is a neurodeficit or any other mental disease. Search physical concomitant, characteristic. Forget about all the symptoms of neurodeficit or even psychiatric cases also. Forget all them. Because वो symptom common of the disease, then what you get? Like autistic child that he was presenting, most of the symptoms were common. But what was uncommon in his case, that before, body built up हो गई है, mind नहीं हुआ है. That body was concomitant rather than the symptoms. Of course, some symptoms ultimately common you will get in many drugs also, like stramonium and every other drugs. You'll get it. But then you will be always inclined to prescribe stramonium, belladonna, all those drugs for those patients because they become common. And you find they are to be given because it is there in the materia medica. Therefore, in a mental cases, psychiatric cases, I will give you example in my multiple sclerosis cases that I am doing now. Time is short, but I will try to present to what is now required in Shobha's lecture was that she will have to, of course, she had no time. If she would have got sufficient time to teach the students, she would have also talked of how miasms are evolving in the case. What is the susceptibility of the patient? Why I am giving 30 potency? Why I am repeating? Why I am not repeating? Why I gave carcinosin? You see, that makes a person logical. And that will make other system of medicine, doctors of other system of medicine to accept you. Now, we have number of multiple sclerosis cases in my clinic. And I have I have two doctors, neurosurgeon, neurophysician, both are there to assess my cases, about multiple sclerosis. And whole multiple sclerosis, what you call as a society, they send me the patients. Are pani pilayenge bhai? Okay. So of course now it will go on long and long. And I hope you are all hungry, no? Hello? Are you hungry? Yes. Even I am hungry. But I am hungry of talking. That is my problem. And unless I don't talk, I will not be satisfied. Okay, let's start my case. Now, the part which was left in terms of susceptibility and miasm, that I will take in my two cases of today. And one case is of a COVID, a homeopathic doctor who was my student, and she became victim of COVID. And what problems you face as a physician in homeopathic practice when a homeopath himself becomes sick? You see, because they will create prejudice in your mind than patient. बिकॉज दे विल टेल यू सर ये मेरे को सिम्टम है ना, जलसेमियम के आए थे, आर्निका के आए थे, ऐसे आए थे, और वो ले भी लेते हैं. दैट आई विल शो यू. एंड देन द कॉम्प्लिकेशन अकर्स इन केसेस where it becomes very difficult for you to prescribe what to do, because then the whole picture is so much masked, and then to make a way out is really difficult. And then the other case of multiple sclerosis, which I will take in short because it's a very long case of 2.5 years follow-up with all the investigations and with all the positive results. Time is short. I will focusing my both the cases on susceptibility and miasm. We will not much discuss about the life space and all these things because time is really very less with us. And if you will remain hungry, you will not learn. खाली पेट को सीखता नहीं है ना, बराबर ना, बराबर, good. चलो, let's start. पहले मल्टीपल स्क्लेरोसिस का केस ले लेते हैं. आ गया, good. Now, of course, this was the objective of the case, where how the deviation from norm that you study in aphorism in organon. And mind well, teacher, as a teacher, you will have to show every case, in every case, whatever management you are doing for the case should be reflected in organon. Otherwise, you will be failure as a teacher, not as a teacher, even as a practitioner. Organon is a way it will show you how to manage the case. मटीरियल रेमेडी का तो खाली दवाएं, सिर्फ दवाएं और कुछ नहीं. Anybody can prescribe, you see. And सेमिनार आप लोगों को तो एक ही चीज चाहिए, कौन सा दवाई दिया. अभी ये जरा डॉक्टर कोई पूछते हैं तो बोलता कौन सा दवाई दिया. अरे भाई दवाई छोड़ो, दवाई तो देंगे, XYZ दो, उसके बाद क्या, what after care, giving the medicine. And that's the most difficult part. And that is where we are failure. Why carcinosin were given many times? थोड़ा ऑर्गेनॉन रह गया था सीखने का, अदरवाइज ऐसा नहीं होता था. और ये जो प्रोग्नोस्टिक की बात करते हैं, मैं आपको how to make homeopathic prognosis, I will send you my what you call as in this thing. It is there in me. I have got with me. You can give to them, because if I talk that, then my main lecture will go away. Fine. So the objectives, deviation from norms. In what way it has, हम लोग पढ़ते हैं deviation from norm, लेकिन उसको application में कैसे आएगा? That is one point. हाँ, perceiving the phase of the disease. हम लोग बोलते हैं ना acute phase है, chronic phase है, ये phase है, वो phase है. So when to, now in his case, before was given. Was it given as acute? Was it given as a constitutional? What made patient to improve? Was that the end of before or beginning of something else? All these issues will come. And all these issues will be only to you if organon is there with you. एक बात बताता हूँ, थोड़ा टाइम लगेगा सर. एक बात बताता हूँ आपको, कोई भी केस हो, आप हिस्ट्री ले लो, पूरी हिस्ट्री ले लो उसकी. आप बाद में आपको दो चीज ही करनी है. आप क्लिनिकल डायग्नोसिस करो, जो भी करना है वो करो, इन्वेस्टिगेशन लो, ये लो, कुछ भी करो, लेकिन प्रोग्नोसिस मत करना. डोंट डू दैट. Don't enter into that field of prognosis. Otherwise, it will reflect in your management of the case. जो भी diagnosis है रहने दो उसको. और second step is, now how I will make this case to understand from homeopathic point of view, individualization. First step, कोई भी case हो, acute या chronic, any case, you find out PQRS if you have. If you have PQRS, first find out. If you don't have, or if you are not able to see, then what? Then Dr. Animan talks of totality of symptoms. आप totality बना के दो, जैसे इन लोगों ने बनाई है, सबने बनाई थी, totality of symptoms. और totality of symptoms से भी नहीं मिलती है तो वो one-sided case हो जाता है, तो you go to disposition of the patient. Try to prescribe on disposition. न्यूरो डेफिशिट में डिस्पोजिशन के सिवाय तुमको कुछ नहीं मिलेगा. और वो भी फिजिकल लेवल पे ज़्यादा मिलेगा, वेयर वी हैव टू सर्च एंड physical concomitant in mental case and a mental concomitant in a physical case becomes the prescription. That is the rule, you know. So, and then अगर disposition से भी नहीं होता है और disposition से अगर होता है तो उसमें जैसे सर ने किसने बताया कि you may get layers, you may have to prescribe many drugs one after other because we are not getting the right similimum. Partial similar हमेशा मिलती है. तो वहाँ हनीमैन भी कहता है कि require many drugs, you know. So, and ultimately will come to the right drug. I think Mayuri, you said that, no? Dr. Mayuri said that. Yeah, fine. So deviation from norm, perceiving the phase is important. हम लोग हैं ना कभी कभी rheumatoid arthritis का केस आता है, severe pain लेके आता है, रस्टॉक्स देते हैं, ओपीडी में बैठे हैं, क्या देने का, severe pain, aggravation, first motion, better continuous motion, joint pain, दो रस्टॉक्स. बहुत खुश हो गए और सिम्टम पेशेंट ने बोला थोड़ा भी मैं पैर हिलाती हूँ तो दुखता है तो प्रायनिया, और ये दोनों में नहीं फर्क पड़ा तो फाइटोलेका. यू सी, ये भी नहीं फर्क पड़ता आर्निका. बिकॉज वी आर टचिंग द सुपरफिशियल थिंग्स विच वी आर फॉरगेटिंग. दिस जॉइंट पेन मे बी एक्यूट बट इट विल नॉट गेट इवन बेटर by number of drugs also. If acute, you will have to prescribe constitutional drug even in acute. So knowledge of prescribing constitutional drug, deep acting drug, pathologicals drug in acute also is part of organon, which comes in one-sided disease. If you really read that, okay. So the patient's experience, her feeling, ये पेशेंट का, जैसे उसने बताया पेशेंट को क्या फील हो रहा था, वो अपने रोग के बारे में या अपने उसके, वहाँ इंटरप्रिटेशन बहुत आती है हम लोग की. पेशेंट को कुछ होता, वी इंटरप्रेट इन मैनी मैनी वेज, यू नो. हमारा एक स्टूडेंट था, वो लेके आया एक हिस्ट्री, बोलता सर इसकी वाइफ मर गई, देयरफॉर हिस्ट्री ऑफ डिसअपॉइंटमेंट इज देयर. ठीक है, तो आया वो, बोला क्या हो गया, आपकी वाइफ गुजर गई, क्या हो गया, अच्छा हुआ मर गई. अरे वो साला डिसअपॉइंटमेंट लिखता है, ग्रीफ लिखता है, और ये बोलता है अच्छा हुआ मर गई. बोला यार तुम उसको पूछा नहीं कुछ क्या हुआ उसको, तुम खाली. मैं बोला तुम खुद ही डिसअपॉइंटमेंट नहीं हुए ना, उसके बाद तो ये प्रॉब्लम नहीं आया. एंड दिस एक्चुअली हैपन्स इन आवर प्रैक्टिस, इट हैपन्स. व्हाट आई हैव सफर्ड एंड इफ पेशेंट गेट्स दैट, दैट इज हिज सिम्टम, नॉट माय सिम्टम. ऐसा हो. Relationship. Chalo, next, fast. We will go fast now. Now, from now onwards, I will take 30 minutes only for both the cases. Okay. Now, she came to me on 25/5/213. It's a case of multiple sclerosis. And as she said, you must know the evolution of the disease. Very important. July 212, left ear pain हुआ. See, अभी आपको मल्टीपल स्क्लेरोसिस कहाँ सिखाऊंगा नहीं. चलो, जुलाई में लेफ्ट ईयर पेन हुआ, ब्लैकआउट जैसे होने लगा, टेंडेंसी टू फॉल बैकवर्ड, numbness and weakness all over the body. That was the initial experience of the patient. It was not diagnosed anything. These were the symptoms. And naturally, if anything happens, doctor will give you some vertin वगैरह दे देते हैं वो लोग because of these symptoms. Later on, the weakness on left side started and descending down from above downwards. Vertigo, later on, patients was given steroid because X-ray MRI was done and it was diagnosed as a multiple sclerosis. Now multiple sclerosis is a big thing. कौन से एरिया में है, कैसे है, किसके सिम्टम कैसे एरिया में आता है, that is a different clinical learning. Next. Now this was the report. You can read the last line, how possibility of demyelinating etiology was there. The first report was this. The second report was confirmed multiple sclerosis after some time. Right, go ahead. 1 year later, in May 2013, everything started in 12. In May 2013, weakness, left hand, and then thigh, and generalized weakness. In one day, एक ही दिन में suddenly ये सब हो गया. पहले आते से जाते थे. Every disease start is an episode. becomes intermittent, becomes recurrent, and then becomes continuous. This is the what Hahnemann has given in your organon. And at what stage he is coming, that is important. In one day, the weakness generalized. Steroid injections were again given. In multiple sclerosis, any neurological condition, either steroid starts with, then interferon, then immunosuppressive drugs. This is the only method in which they go. There is nothing more than that in any condition, you know. Yeah, of course, all the vitamin D3 and they give as a supplementary. So, MRI report of 18.5 after previous one. As compared to the previous MRI dated 14/7/12, there is a marked decrease in size of the signal alteration within the upper cervical spine, cord with, however, small signal alteration areas in spinal cord. So there are some changes occurred. Initial aspect is not further developed. Go ahead. Development of pericallosal periventricular white matter lesions is also seen. This is the sign of what you call as sclerosis, which were not seen in the earlier MRI study. And therefore, it was confirmed as next. Spinal cord and pericallosal periventricular cerebral white matter appearing recent. That means the disease has progressed now further. In 1 year of time after taking all those allopathic. Considering varying ages of, now this is a clinical part, how different what you call as changes occur in the spinal cord, demyelinating lesion, possibility of multiple sclerosis is there. So that is how it was diagnosed. Yeah. Next, advice cortisone as usual, Vertin, Stemetil for 1 month. Go ahead. Now this is what happened. Now she comes to me. Where she stands, that is very important. What was there has evolved. Now at present, what is the state of the patient? Mental as well as physical, both, you see. And is there any change in her personality before disease and after disease? That is what I said, deviation from her norm. What she was and what she is now. And what has triggered what she is now. That is important. Ailments from. Yeah, go ahead. Lately dull, sensitive to light and noise. Sensitive to light and noise becomes irritable. Now once you may be sensitive to light and noise, किसी को headache होता है, किसी को blurring, ये तो गुस्सा करती है. So the impact of light and noise is such that it affects the emotional part of the body. You can understand the depth of the response, not the noise. It's a response, hyper response. That is very important, you know. Yeah, giddiness, tendency to fall backward, cannot think anything. At that time, confused हो जाते. Next, sleepless, thirst is less, stool constipated. Constipation and retention of urine, vision are the initial symptoms of multiple sclerosis. Hungry, overeats. Now that was because of steroid that she was taking. You should know the bad effects of various drugs. Whether you will consider in totality or not, that is another part. Menses scanty, anxious about her illness. Go ahead. Now, very hot internally. Now she is hot internally. What is her age? She is not in a menopausal age. She is quite young. Now internally I feel very hot. Heat of sun aggravates. Covering aggravates. Wants fan or sleep in air-conditioned room. Cannot travel in train or car. Suffocated in closed room. Doors and windows open. पहले चिली था बिफोर सिकनेस, अभी हॉट हो गई. अब इसमें मत जाना क्यों हो गई, क्योंकि हमारी डिस्कशन होता है जब भी हमारे उधर, वो क्यों हो गई, अरे वो ऐसा किया होगा, ऐसा किया होगा, ये हम लोग इंटरप्रिटेशन कर करके मर जाते हैं. खाली देखो ना, पहले ऐसी थी, अभी ऐसे बराबर जैसा है ऐसा रहना दो ना. Let him be as it is and not put your colors in there. Fine. 2009. Now this is what happens. 2009 में उसका ब्रेक हो गया था. उसकी एंगेजमेंट हुई थी और वो लड़के के साथ कुछ गड़बड़ हो गई होगी. और डिसअपॉइंट हो गई और लड़के ने उस धोखा दिया. Disappointment, grief, strong feeling of being cheated. Now I have given you directly the event. I have not given you the whole because it takes long time to have interaction with the patient. Mind well. And हम लोग के हिंदुस्तान में हमारी लड़कियां थोड़ी शायफुल और ये होती है, ऐसी बात ज़्यादा जल्दी करती नहीं है किसको. आजकल के ज़माने की बात अलग है. वो तो सामने वाले को डिसअपॉइंट करेगी, अपने आप को नहीं करेगी. वो क्या दूसरा जा गेट लॉस्ट, यू नो क्या लगा है. हाँ, पहले लड़के लोग बोलता न थे कि तू नहीं और सही. आज लड़कियां बोलती है तू नहीं अनेक सही. बहुत है हमारे पास. So she was a breakthrough. But this girl, I will tell you, wonderful girl she was. Breakthrough in engagement, disappointment in grief, and grief, strong feeling of being cheated. ये उसके माइंड में बहुत था. मुझे चीट किया उसने. मैंने क्या किया था? मैंने तो कुछ नहीं किया था. उसने मेरे को चीट इसलिए किया. हम लोग उसको पूछेंगे क्यों किया? That is not required. She felt cheated, that's all. हम लोग क्यों उसकी हिस्ट्री में जाएंगे? और वो तो ज़्यादा और स्टोरी बताएगी. तुम और डिटेल में जाओगे एंड देन इट विल बिकम ए होटल में बैठ के बात करते हैं ना हम लोग एक दूसरे से, ऐसी बात हो जाती है. इट इज़ नॉट केस टेकिंग. यू सी, डिसअपॉइंटमेंट, स्ट्रॉन्ग फीलिंग ऑफ बीइंग चीटेड, बिट्रेड. सप्रेस है, अंदर से गुस्सा है मेरे को, बहुत अंदर से गुस्सा है. वेंजेंस है उसके लिए. क्या कर डालूँ मैं? स्टेप से गिरा ना. ऑल ऑफ यू थिंक ऑफ स्टेप, एटलीस्ट स्टेप से गिरा. किसी के तो माइंड में आया होगा. मेरे माइंड में तो आया था, उस बार आया था, अभी नहीं आया. तो बस यहीं हमारा डेविएशन शुरू होता है. ऐसा हिस्ट्री लेते और ये आया स्टेफी से गिरा या कोई भी ड्रग आपके माइंड में आ गई तो समझना कि यू आर डेविएटेड, बिकॉज यू आर कंक्लूडिंग बिफोर एवरीथिंग इज बीइंग विटनेस्ड. ऐसा हो जाता है. ओके, गो अहेड. राइट. Brooding. Now, this is the present state of her mind. Brooding, weeping, suicidal thoughts, feeling of being stung by snake. મને તો એવું લાગ્યા હતા, ગુજરાતી તું સરસ બોલતી હતી, મને એટલું નથી આવડતું. પછી આવીને મને કે મને તો સાપે ડંખ માર્યો છે, એવી ફિલિંગ થાય છે કે સાપ હતો અને મને ડંખ માર્યો છે. મેં તને એ સાપ લાગે કે તને ડંખ લાગે છે? સી, ધીસ ઇઝ ઇમ્પોર્ટન્ટ. A snake like is one thing, and if you feel it, you are stung, that is the symptom you have to take. નહીં તો આપણે પછી ચાલ્યા કરે સ્નેકનો ડંખ તમારો લેકેસિસ અપાવી દો. બરાબર ને? ઓકે. અને that is your sting to her by giving her such a drug. Feeling of being stung by snake, poison feeling, poison. Now these are important points. Deviation कहाँ आया? After disappointment, this is the state of the person, and person from hot to chilly to hot has become hot now. Fine. Marriage 1 year now. હવે પછી તો એને મેરેજ થઈ ગયા અને એના સસરાવાળા બધા સારા હતા એટલે એને બધું એક્સેપ્ટ કરી લીધું. એના થિંગ વોઝ દેર ઇઝ નો પ્રોબ્લમ એટ અ મેરેજ લાઈફ. ગો એડ. Soon after marriage she got this problem. Now see, एक लड़की जिसको डिसअपॉइंट हुआ है, दुखी है, उसको एक अच्छा घर मिला, अच्छा लड़का मिला, और ये बीमारी आ गई. वो अपने आप को क्या समझेगी, क्या समझेगी अपनी ज़िंदगी के लिए? वो ये सब समझना बहुत ज़रूरी है. दैट इज शी, यू नो. फाइन. सून आफ्टर मैरिज शी बिकम सिक. एंग्जाइटी, व्हाट विल हैपन इन फ्यूचर. अभी तो शादी हुई मेरी, यू नो. हस्बैंड एंड इन लॉज वेर वेरी गुड. लक्की इनफ टू हैव अ गुड इन लॉज. गो एड. By nature, she is mild, reserved, anxious, and responsibility लेती हो घर में. Now I have given you direct the symptoms na, because long history is there to know that she is responsible or not, you know. Completing the work fast, जल्दी जल्दी काम करवाનું, एंग्जाइटी રહ્યા કરે, જલ્દી કામ પતાવો, જલ્દી કામ પતવું જોઈએ. કોઈ આવ્યા હોય તો મને ધડધડ થાય, કેમ કામ કરવું, કામ થશે કે નહીં, હું જો ખોટું કરીશ તો લોકો શું કહેશે મારી માટે. This were what is her state of mind as a basic nature or his disposition, you know. Confused, અને જ્યારે whenever such situation occurs, she gets confused. Anxiety, confusion. Now irritability has come. You see how the state is going. Takes time to settle, think કે પછી હું શું કરું, બેસી જાઉં, વિચાર કરું ને પછી હું ડિસિઝન લઉં. That was her previous nature. Hi boys, you are okay? Sure. I'll finish in 30 minutes now, okay? Go ahead. Every time I say 30 minutes, you have to understand. Go ahead. Anxiety, yeah. Yes? Previous क्या बोलो तुम? अरे क्या जाए तू आगड़ आगड़ भागे છે જરા પાછળ જા. Previous એની આગળનું. હા. So takes time to think and now come next. Anxiety aggravates. ક્યારે પણ એન્ઝાયટી આવે? આ તો કેવી રીતે સવાલ પૂછો એ પણ ઇમ્પોર્ટન્ટ છે. એન્ઝાયટીનો મતલબ શું? પહેલાં તો પેશન્ટ મેં સામે હું તો મને બહુ સ્ટ્રેસ લાગે. હવે સ્ટ્રેસ એટલે નાનો હવે તો 10 વર્ષનો છોકરા સ્ટ્રેસ આવે. 10 વર્ષના છોકરાને શેનું સ્ટ્રેસ આવે? એની મધર એને વઢે છે કે એનો બાપો એને કંઈ આપતો નથી, એમાં સ્ટ્રેસ આવે ને. કોમ્પ્યુટર નથી મળતું, એ બધા સ્ટ્રેસ આવા બધા થઈ ગયા. એન્ઝાયટી એગ્રેવેટ્સ. ટુ ફેસ એની સુપીરિયર, જ્યારે ઓફિસમાં કામ કરે કે ટીચરને મળવાનું તો એને જરા એન્ઝાયટી આવી જાય. ગેસ્ટ જ્યારે ઘરમાં આવે ત્યારે કોમ્યુનિકેટિંગ ઇમ્પોર્ટન્ટ પર્સન બધું પૂછવાનું. હા, એન્ઝાયટી ઓફ argentum nitricum, anxiety of jalsemium, anxiety of calicarb, and anxiety. ત્રીજું 1, 2 ને 3 ડેવિએશન ફ્રોમ નોર્મ. હલો. હા, કોમ્યુનિકેટિંગ ઇમ્પોર્ટન્ટ. ડિસિઝન્સ લે છે પણ કન્ફ્યુઝ થઈ જાય છે. સો હું તમને જલસેમિયમ, અર્જેન્ટમ નાઇટ્રિકમ, કાલિકા, થુજા, ડીપ સીટેડ એન્ઝાયટી, નેક્ટ્રમ, આ બધી એન્ઝાયટી અલગ અલગ છે. યુ મસ્ટ નો ઓલ ધીસ થિંગ્સ, યુ નો. ગોઈંગ આઉટ ફોર લોંગ જર્ની જવું હોય ત્યારે એને ટેન્શન આવે. યસ, ગો હેડ ફાસ્ટ. I want to give them food, go fast little. She takes advice from other, પણ ડિસિઝન પોતાનું. આ ટિપિકલ ગુજ્જુ છોકરી. ગામને પૂછશે મારે શું કરવું, પણ ધાર્યું તો પોતાનું જ કરવાનું. બરાબર ને કલ્પિતભાઈ? હા. હા. અને તમને જ્યારે સેમિનારમાં ચાન્સ મળ્યો તો માઇક બંધ. ઓકે, ગો હેડ. Takes advice but decision of her own and she is firm. એકવાર ડિસિઝન લઈ લીધું પછી છોડે નહીં. માઇન્ડવેલ ડિસિઝન પાછળ ઘણા બધા સિમ્ટમ્સ હોય, એટલે આ તો શીખવાડા બેસીસ તો આખા વર્ષો નીકળી જશે. અધર્સ એડવાઇઝ ઓર ઓપિનિયન. સેન્સિટિવ ટુ ક્રિયા, પોતાની કોઈ એને સેન્સિટિવ, વેરી સેન્સિટિવ ટુ ક્રિટિસિઝમ. બટ યુ મસ્ટ આસ્ક વોટ હેપન્સ. વિપ્સ, ફીલ્સ વેરી બેડ એન્ડ લાઇક્સ ટુ બી અલોન. જ્યારે કોઈ ક્રિટિસાઇઝ કરે તો રડવા માંડે. કોઈ કહેતું હતું ને લેડીઝો બહુ રડે. કોણ બોલ્યું હતું હમણાં અહીંયા? એવું કાંક બોલ્યું હતું. હા, પ્રવીણ કુમાર. હા. તો શી વિપ્સ, જ્યારે એને આવું ટેન્શન આવે, ક્રિટિસાઇઝ કરે તો રડે, પોતાની જાતને એને એકલા મૂકી દેવાનું. દેટ ઇઝ હર વે ઓફ રિસ્પોન્સ. ગો હેડ. નાઉ ધીઝ આર ઓલ કેરેક્ટરિસ્ટિક. The response is characteristic. She is not a fighter. She would like to escape. બહુ ઝંઝટ નહીં કરે, ભાઈ છોડી દો, માથાફોડી નહીં કરવાની. ઘણી લેડીઝો હોય ને, તમે એક સવાલ પૂછો ને તો એ 10 જવાબ આપે. અમારી એસિસ્ટન્ટ છે કમ્પાઉન્ડર, એને મેં કીધું તો એસી તે ચાલુ કર્યું, સ્વિચ ચાલુ કરી, પંખો બંધ કર્યો છે, બારી ખુલ્લી છે, તો આનો મતલબ શું? તો કે तुम्हाला नाही आवडते ना, मराठीમાં बोले. तुम्हाला बाहेरची हवा पाहिजे ना, म्हणून मी एसी बी चालू केला आणि हे बी चालू केला. હવે આને મારે શું જવાબ આપો? હા, ઓકે. નોટ અ ફાઇટર, એસ્કેપ ફ્રોમ સિચ્યુએશન વેન ઇટ ઇઝ નોટ ઓફ હર લાઇકિંગ ઓર શી વુડ or in favor of or એનું ધાર્યું કોઈ ન કીધું હોય તો કે છોડી દે પણ ફાઇટ નહીં કરે. I would better leave it. Brute still matter is resolved. Yeah, please go. Go ahead. Now as a child, somebody took no evolutionary totality. As a child, in chronic case you have to go through evolutionary. As a child, fear of dark, being alone, fear of height, anxiety and vertigo, palpitation and nervous. Anxiety, vertigo તો already હતું જ નાનપણથી, પછી anxiety વધવા માંડી અને જ્યારે બીમાર પડી ત્યારે anxiety has aggravated. Go ahead. Now, प्रवीण भाई, ये गुज्जू है, लड़की, desire sweets, बराबर ना? हाँ, and spicy food. Tendency for constipation. Now this constipation occurring during multiple sclerosis is one thing, and constipation tendency from childhood is another thing. If it is because of multiple sclerosis, you may not consider important, but this is since childhood. So already constipation tha और उसमें sclerosis है, so you will have to consider it as a constitutional symptom rather than considering a local symptom, you know. Okay. At times, nightmares, mind active in sleep, skin dry, palms and soles cold and perspiring. Always keep it in mind, palms and soles हमेशा तपासवाना दरेक केस में. Go ahead. Past history, tonsillitis, frequent in childhood, family history, no major illness. Now you see, in this case, miasmatic load is not much. Only tonsillitis, that is tuberculosis. Tuberculosis at the most you consider. There is no load on miasma. Now in this case, the load of life situation is there. Therefore, it can be cured. You take from me. When there is no load at family history level or no load at past history level, you can cure. 100% you can cure. Provided the tissues are not dead. Functions are intact. That also you have to keep it. So pathology you should know. You see, you may cure, but in those cases that she showed you, where you cannot do anything except give palliation. You see, so that stage comes. Yeah, go ahead. Now this is the different way in which the multiple sclerosis represents to you. Relapsing and remitting, that is Hahnemann's intermittent disease, if you remember. Or secondary progressive, that is exacerbation. You know, no? In homeopathy, ये organon है. What I am trying to teach you. This is required because for management purpose. Agar patient has come in relapsing, how you will manage? If he has come in secondary progressive, how will you therefore it is necessary. So primary progressive, continuous progressive है. And then progressive and relapsing. Progress तो हो गया, फिर relapse होता है. So that is, in this case, it was relapsing remitting. आया गया. And when she came to me, she had come in a absolutely remittent state. But disease is undercurrent going on. Expressions are not there. Go ahead. Clinical type remitting relation. Susceptibility is good. Now that part I am coming to it. Susceptibility is good. Why it is good? Are boys who are in third year, fourth year? कोई है क्या third year, fourth year? अरे very good. अरे कोई नहीं है थर्ड ईयर फोर्थ में. अरे लवली. तो मुझे बताओ ये ससेप्टिबिलिटी क्या होता है? Okay, go ahead. So susceptibility is good. She is mentally alert, physically alert. Except the clinical condition, everything is you get characteristic symptom, you get good character disposition. Disposition is good. I mean susceptibility is good. No miasmatic or hereditary, that I told you earlier. Prognosis favorable to cure. See, I have written this right from day one. आप बताते हैं सर prognosis. So these all things must be considered for prognosis, not only clinical condition. You see. Yeah, go ahead. Perceiving this case is an evolutionary phenomena and differentiate the pre-disease and disease state. Understand? Pre-disease and disease state. Evolution. Go ahead. Pre-disease state, anxious, mild, reserved, sensitive to criticism. Go ahead. Anticipatory anxiety, fear of height, which causes anxiety and vertigo. Go ahead. As a child, fear. This was pre-disease, no? Right? And fear of dark and go ahead. Like sweets, these at a physical level. That was mental level. At a physical level, all these things, which I already talked. Palms and soles are perspiring, cold, tendency to constipation. Okay, go ahead. Mind continuous, and now, what is the mind? Continuously active, at times nightmare. Wakes up frightened, now. Go ahead. Disease state, march of events from 2009 to 2013. Break in engagement, disappointment. This is all the march of event. Grief, strong feeling of being cheated. Go ahead. Suppressed anger and vengeance. This is the state of mind now. Brooding, weeping, suicidal, feeling being stung by snake. Go ahead. 212 left ear. All mind was like this and left ear got affected. To start with. Vertigo, tendency to fall backward, numbness, weakness and left hand. Neurology में एक है कि when 5 senses are affected, if they are not related with that particular organ, that means आँख का आँख से कोई निस्बत नहीं है, फिर भी आँख के सिम्टम है. स्किन में स्किन का कोई प्रॉब्लम नहीं है, लेकिन फिर भी है. या सुनने में कोई प्रॉब्लम है, आँख कान में कुछ नहीं है. Then you consider somewhere there is problem in neurological condition. You must ask for MRI if that is so. Go ahead. So weakness, numbness, generalized, treatment steroid given, appetite increased because of treatment. Go ahead. Hot, now she has become hot. So this totality I had taken after illness, ailments from till today. That's the phase. And on the basis of that phase, the prescription was made. Go ahead. Now two possibilities. ये दो possibility हो सकती है. Either you give on the present state of mind and body, or you prescribe a drug which covers up both the present state as well as the personality, other part also, both. ये दो approach है आपके पास. लेकिन ये दो में से कौन सा लेना और क्यों लेना? तो ये दो में से because her constitution is changing, उसकी चिली में से hot हो गई है. वो जो माइंड उसका था वो अलग है, पहले जैसा नहीं है, इसलिए फेज रेमेडी दिया उसको. गो एहेड. Oh, 1 minute, come back. Aphorism 173 to 245. You must show to the students कि इसमें ये दिया है जो मैं आज बोल रहा हूँ. Go ahead. Second is take present phase and give the medicine. Go ahead. What to do? Go ahead. Second proposition, total thermal change, state of mind after illness, experience of the mind after disappointment, location and pathology. You understand? Therefore, phase remedy was given on that basis. Go ahead. Lachesis was given and it was long follow-up है. एक 1M से लेकर 10M दिया, उसके बाद जरा वो नीचे आ गई. लेकिन the disease process was there. She was in a remittent stage, but still it was there. Change of phase, उसको सिलिशिया बाद में दिया था. ये I'm shortening it, it's a very long follow-up. उसके बाद मैं आपको बताता हूँ क्या हुआ. Yes, go ahead. General condition, no constipation. Yes, तो natural है, सब होने वाला है. Go ahead. No major problem. In between, she wanted to have a child. अभी सवाल ये आता है, वो आपको पूछेंगे should I get pregnant or not? तो क्या जवाब देना? ये another problem. You see, there are many conditions which create problem to you. So मैंने बोला भाई देखो एक काम करो, तुम्हारा सब अगर hormones normal है, you go ahead, medicine will take care. In fact, in such cases, when they become pregnant, hormonal changes become so much that even the present condition gets better. On the contrary, ऐसा होता है. तो मैंने बोला आप क्या, बट आता है क्या नहीं, आवाज़ आता है, आ रहा है ना? हाँ. So I told her कि you better go ahead, but keep a gynecologist along with you. उसके बाद उसको abortion हो गया. Again there was a problem. Abortion हो गया. देखो, see when you treat, बीच में बहुत external environmental problems आते हैं जो आपका जो किया हुआ है पानी में जाता है. और ये तो मेजर था, एबॉर्शन हो गया. चलो, go ahead. There was no complaints, गो अहेड, गो अहेड. उस टाइम तो उसको दूसरी प्रेगनेंसी हो गई. देन शी वाज फ्राइटन कि अभी दूसरी प्रेगनेंसी हो गई है तो मेरा क्या होगा, बच्चा होगा क्या नहीं. मतलब डोंट वरी, यू गो अहेड, नथिंग विल हैपन. या उसके बाद न्यूरोलॉजिस्ट का ओपिनियन भी लिया. एडवाइस विटामिन B12 ये तो नेचुरल है. आ जाओ, गो अहेड. सी द डेट दिखाओ, डेट अगले का. डे 8/4/15 to 9/5/15. ये मतलब लंबा वो था. तो शी केम टू मी इन 13, नो. तो 2 साल हो गया उसको ऑलमोस्ट. ये सब दिया था. उसमें उसको एबॉर्शन हो गया, प्रेगनेंसी हो गया, बच्चा भी हो गया. गो अहेड. समटाइम शी यूज टू फील टायर्ड, सो कभी कभी एक्यूट ड्रग दे देते थे. बहुत टायर्ड है तो नहीं. नो प्रॉब्लम्स, गो अहेड. शी हैड 1 abortion, मैंने बताया आपको. Then again delivery. Last visit was in this 215. Since then there is no problem and evidence I am giving you. Because you see there are many aspects. They don't go for MRI. अभी अच्छा है ना नहीं जाने का. लेडीज़ को, गुजराती लेडीज़ को तो आदत होती है खास करके. वो 2-3 दिन દવાઈ લેતી हैं. મને એમ કે તમારા ભાઈ કહે છે તો હું કંઈ દવા, એટલે હું આવી તમારી પાસે. અરે ભાઈ તારા ભાઈ કીધું ને તું આવી તો ભાઈ તો મારે તો દવા જ નથી લેવી. 2 દિવસમાં સારું થઈ જાય, એમાં શું દવા લેવાની, યુ નો. પછી બહુ વધી ગયું એટલે તમારા ભાઈએ કીધું કે તમે આમ લો ને તમે આમ કરો ને. ઠીક છે દવા લે. બીજે દિવસે આવે, તમે કઈ દવા આપી, જરાય સારું નથી. મને સારું હોય તો પણ ક્યાં, જરાય સારું નથી. કારણ કે એના હસબન્ડને કીધેલું આવવાનું ને એને નહોતું આવવું. એટલે પછી હસબન્ડને કહે કે જો કાંઈ મને સારું નહીં થયું, એની કરતાં હું દવા નહોતી લેતી એ સારું હતું. સી ધીસ ઇઝ હાઉ ધ પીપલ પ્લે ગેમ વિથ યુ. ઓકે, ગો હેડ. હવે આનો વિડીયો ચાલુ કર ભાઈ. બીજી વાલામાં આ તને આ મેં એપ્રિલમાં રાજકોટ આવેલો હું, ત્યારે મેં આનું વિડીયો લીધેલો. એટલે 2000 ને આજે કેટલું 23 થઈ, 24 આજે. યસ, બટ આઈ એમ ટોકિંગ ઓફ વિડીયો ઓફ 2000. But I must appreciate your sensitivity, that you are able to pick up the mistake. That's good thing. Fine. Thank you. ચાલુ કર્યું? એ ભાઈ અવાજ કર.
After that, my life had come to
પહેલેથી કર, પહેલેથી.
and she found that I had been diagnosed with condition 2012. After that, my life had come to a standstill. With relapses, I was bedbound and I had even to take help to go to the restroom even. So I had to look into many options of medications. I came across allopathy, but I was very reluctant in taking allopathy medicines because we know of the side effects it provides. So when I came in 2013, I came across in contact with Dr. Kishore Mehta. So he, along with his homeopathy experiences and the dosages that he gave me, he brought a really big positive change in my life. We all know that there's a saying on is Dr. Bhagwan ka roop hota hai, and it's very true in my life. Thank you, sir, because of his homeo experiences and his medications. Today, after almost 6-7 years, I haven't taken any dosage of homeo or any dosage of any other medications for MS. And it's very true because that part of life that I was going through the first, when the MS was diagnosed first, I had many relapses. I had even to lose my job because of my health. But after taking these medications, the last MRI that I had done was in 2013, then there was no need of any MRIs, no need of any medications. And now, with his help, and I am living a very fulfilled, happy life. I'm a full-time IT professional. I'm a mother to a 5.5-year-old kid, and living my life to the fullest. Thank you, sir. Thank you so much.
Okay. मुकेश ने बताया था ना कि पेशेंट की जो हैप्पीनेस है वही बड़ी चीज़ है. You see, that's very important. Now I know that this girl, everything is under control, but when a very big problem will come in life, she may again get. So I don't say that it is cured, but I would say yes. अभी आप देखो 2015 से लेके 2024, nothing, no problem. And just 1 year back this was taken. You can understand. So बच्चा भी हो गया, उसका 5 साल का बच्चा है उसको. Fine. इससे ज़्यादा आप क्या कर सकते हो उसको? That is more than enough that you can do. Are you ready for 10 minutes more? Say yes. अरे गुजरातीમાં ને ઇંગ્લિશમાં યસ કહો. ओके चलो फटाफट वो डॉक्टर का केस चलो. ये दिस वाज अ केस ऑफ कोरोना ऑफ अ होम्योपैथिक डॉक्टर एंड lot of zigzag way it has gone because of interruption by patient herself, you know. Yeah, kholo. Go ahead. हाँ टाइटल तो दिखाओ यार. टाइटल के बिना पिक्चर कैसे आएगा? Susceptibility and pathology. That was the main thing, you know, of my topic today. Yeah, go ahead. Now this particular doctor, homeopathic doctor, huh? And fortunately my patient, and unfortunately that she became my patient. You know, my student but became doctor. Now she was working in, hey, bhai, koi aake padega ya? Anybody can read this data so that I have a less program. Hey, અહીંયા આવતો બેટા. મેં તારો અવાજ સાંભળ્યો ને મને બહુ ગમ્યો. હવે ખાલી આ વાંચ.
Working as a chief medical officer in a diagnostic center for cancer, HRCT, MRI, nuclear medicine, etc., she saw a lady patient who had pleural effusion, very restless and breathless in theatre. She did not her physiotyping. Okay. While doing this, patient vomited 3 times. Our doctor patient was drenched by vomiters. Her mask and clothes got spoiled with vomiters of that patient.
आवाज आता है क्या? हेलो हेलो हेलो. हाँ. This girl, really I'll tell you, most of my students, homeopathic doctors, girls, they are very, very dedicated, you know. They may not have time because of family matters, but they really learn very nicely. And this girl also really very punctual in my clinic. Every Thursday we have meeting. Since last, I was telling them, last 40 years, every Thursday my clinical meeting at my clinic is there. Now we are doing webinar. Not they don't come because they come from far. But this girl, very sensitive to patients. She has been trained that way to be sensitive to the patient, you know, and really dedicated to. Therefore, she used to do everything for the patient. That is why what happened to her, you know. Go ahead, yeah, please. Sorry to interrupt you. लेकिन आस्ते आस्ते जाना जैसे तुम्हारा केस है.
ठीक है सर.
हाँ? Go ahead.
The patient, whom she saw later on, turned out to be COVID positive.
Patient जो उसका patient जिसने उल्टी किया था वो COVID थी उसको. Now this is a time of 221 I think. Yeah. Yeah.
After few days, 10th May 2020 evening in clinic, sore throat 3 and dryness 2, thirst +2. Same night, pain in both legs and severe backache.
This was her complaint. Okay.
Pain as if back would break into pieces, restless +3. No position or pressure relieved her. Appetite was normal. Feverish in the evening and then 99 to 101 by midnight. She took arnica 1 mg, aspirin, aggravate in 4 hours slept.
You understood? What happens to us, a homeopathic doctor who is sensitive कि एलोपैथी नहीं लेना है, लेकिन बुखार आया है, दवाई आर्निका लिया क्योंकि ओवरवर्क हो गया था, ये होता जो भी था, आर्निका लिया, नहीं अच्छा हुआ तो डिस्प्रिन लिया, उसके कोई वाक नहीं है. घर में हस्बैंड होते हैं, फैमिली मेम्बर्स होते हैं, ये क्या होम्योपैथी करती है. एंड यू टेक फ्रॉम मी, आवर पेरेंट्स, आवर फैमिली मेम्बर्स आर नॉट सो मच मोटिवेटिंग टू अस व्हाट सेमिनार्स आर मोटिवेटिंग टू अस, यू नो. तो क्या आर्निका लिया, तुम डिस्प्रिन ले लो, यू नो. आज भी मेरे को मेरे बड़े भाई बाबा बोलता है, बाबा तेरे को कुछ क्या सफ़ेद गोली देता है, एक इंजेक्शन दे दे मेरे को बस. सी दिस इज व्हाट हैपेंस टू मी आल्सो एट दिस माय एज, यू नो. तो ये तो बच्चे हैं, यू नो. और वो भी एक तो आदमी ऐसा निकला मेरा पहचान वाला, वो बोलता है तुम डॉक्टर है. हाँ. कौन सा किया है वो डॉक्टरी? मैं बोला होम्योपैथी किया है. they look to us as if we are culprit. होम्योपैथी किया है, दैट मीन्स कि क्या है होम्योपैथी का? अरे भाई पहले तो होम्योपैथिक डॉक्टर को डॉक्टर का नाम सुनते थे, होम्योपैथिक डॉक्टर तो कोई लड़की शादी नहीं करती थी, ये होम्योपैथिक डॉक्टर इसे क्या करने का? दैट वाज अ स्टेट, यू डोंट, आई मीन दिस अ फैक्ट आई एम टेलिंग यू, नॉट जोकिंग. तो बात ऐसी होती है, आगे चलो. बट यू विल मैरी होम्योपैथ, नो? इफ एट ऑल, इफ यू वांट टू मैरी, यू मैरी, नो? गो अहेड.
11th May morning, dryness plus 3, burning micturition plus 3.
Now you go date wise, evolutionary totality in acute condition. Go ahead.
Stool hard, thirst plus 3. Fever 99 whole day, body ache plus 3. Scratching in throat, drinking water, burns or hurts. Went to clinic, feeling feverish and cold. Evening very weak plus 3. Body ache like previous night. Eupatorium per perfoliatum 1 m. No fever at night, slept few hours.
बराबर है. इतनी बीमार होते हुए भी वो गई, फिर आके गिर गई. ठीक, गिर गई बोले तो गॉन डाउन विथ बैक एक एंड बॉडी एक. एंड एज यूजुअल बॉडी एक, यूपेटोरियम, सिंपल, यू नो, ओवर एक्सर्शन, आर्निका, यूपेटोरियम ले लिया. और हमारे यहाँ कितना आता है अपना क्या बोलते हैं व्हाट्सएप पे, यूपेटोरियम फॉर दिस, क्या क्या लिखते हैं लोग यार, पागल एकदम. और कोविड के टाइम पे तो जलसेमियम से लेके क्या क्या, फॉस्फोरस एंड वो तुम्हारा कौन सा कैम्फर, और जिसने ये यूज़ किया ना वो सबको कोविड हो गया, इंक्लूडिंग दोज पीपल हु हैड रिकमेंडेड दैट ड्रग. क्या बोलने का यार. एक ने तो सीपिया बोलता है, सीपिया छांटो पूरे शहर में. क्या यू नो, डिसइंफेक्टेंट, क्या यार. तो एवरी मैन मस्ट टेक सीपिया आफ्टर 40. एम आई राइट प्रवीण भाई? ओके, गो अहेड.
12 May in morning after waking, diarrhea, painless, odorless,
So this is third day.
no flatulence, watery, 3/4 times control, weakness plus 3, perspiration plus 3, thirst plus 3, dryness plus 3, soreness plus 3. No fever.
And intensity of symptoms must be considered. सीधा खाली थर्स्ट है ये वो छोड़ो, कितनी है, वेरी इंपॉर्टेंट. या
No fever whole day, weakness plus 3, thirst plus 3, dryness plus 3. Drinking large quantity of warm water through like to take cold water followed protocol. Prescription arsenic carbon 1 m, 1 dose, ameliorate diarrhea.
देखा क्योंकि उस टाइम हमारे सीसीएच ने भी लिख दिया था, सीसीआर आर्निका, आर्सेनिक, वो लोग ने भी लिख दिया था सबको. और मैंने मिड डे में आया था उसका रिपोर्टर मेरे पास, सर व्हाट अबाउट आर्सेनिक. तो मैंने उसको सीधा बोला, इट इज़ अ फेक, इट इज़ यूजलेस अनलेस इट इज़ नॉट प्रूव. तुम खाली सिम्टम लेके खाली सीसीएच में दे देते हो तो दैट इज़ नॉट करेक्ट. इट इज़ अगेंस्ट द बेसिक प्रिंसिपल ऑफ होम्योपैथी कि जब भी एपिडेमिक होती है तो कम से कम तुमने 10-15 केस नहीं देखे हैं, टोटालिटी नहीं बनाई है, कोई एक ड्रग नहीं निकलती है. हाउ यू कैन मेक इट जीनस एपिडेमिक जस्ट ऑन द सिम्टम्स ऑफ द ड्रग एंड दैट ऑफ द डिजीज, नॉट ऑफ द पेशेंट. इसी तो मिड डे वाला आया था मेरे पास, तो मैंने बोला उसको ये बकवास है. तो मेरे को फ़ोन आया, आपने ऐसा कैसा बताया. मैं बोला जो मेरे को अच्छा लगा था मैंने बताया, मैंने तो कुछ झूठ तो नहीं बोला है. फिर उसने मेरे को ऑर्गेनॉन का चैप्टर्स भेजा सब कि ऑर्गेनॉन में ऐसा दिया. तो मैंने उसको बोला भाई ये जो ऑर्गेनॉन तुमने मेरे को भेजा उसमें आप पढ़ो तो सही कि पेशेंट देखने के बाद जीनस एपिडेमिक निकलेगा. उसने कहा है कि आप दे दो दवाई जीनस एपिडेमिकस में. तो ये सब क्या प्रवीण भाई, बराबर ना? चलो या.
She suspected COVID, but no investigation done.
नहीं किया उसने. क्यों नहीं किया? वो होएगा तो घर पे रहना पड़ेगा या हॉस्पिटल जाना पड़ेगा. यू सी हाउ माइंड वर्क्स. गो अहेड.
No investigation done out of anxiety and not following family members' advice not to go for center.
But on her action that she took, as far as arnica, arsenic, these, you must understand state of her mind. वो हमको उसका वो नहीं करने का है कि ऐसा किया, वो ठीक नहीं है. उसका माइंड क्या है? Why she has behaved like this, taking this medicine. Is it only anxiety? Is it only fear? Or is it fear of death? Or fear of environment in the family. उसकी वजह से जल्दी जल्दी अच्छा हो जाओ, you know. तो ये सब काफ़ी चीज़ें होती है इसके अंदर. Go ahead.
13 May, 26 May, worked in center. Generalized soreness, dryness, burning thirst progressively, +3, increasing. No fever since then, but coldness even may not hot, noon, sun. Whole day perspiration +3, drenching and weakening her. Normally she does not perspire, weakness +3. Appetite decreased. Because of perspiration, she used to feel cold and wanted to cover till head. Wetness of sweating, amelioration and aggravation rest all through.
मई महीने के अंदर आर्सेनिक लिया, सब सिम्टम अच्छे हुए, लेकिन शी फेल्ट चिली सो मच. एंड इन मे मंथ यू नो व्हाट द समर इज, यू नो हॉटेस्ट समर. और मई महीने में वाइल शी इज गोइंग इन द स्कूटर टू द क्लिनिक, शी यूज टू फील सो मच कोल्ड, शी हैड टू कवर these things. Such chilliness was there in her, with thirst and everything. So now you can understand gradually. Now why I am telling you this susceptibility. In spite of taking allopathic medicine, her susceptibility is not altered. Still some characteristics are coming up, which I have to now consider from day one. पहले दिन में कौन सा कैरेक्टर था, दूसरे दिन में कौन सा था, तीसरे दिन में कौन सा था. भले वो चला गया after taking allopathic medicine, but they were there. And I will make totality on the basis of that, plus today's condition. You understand my point? Am I clear, sir? Boys, you may not be clear, probably. Yeah.
In between 20 to 25th May, every complaints aggravated. Evening throat, ice cream took it many times, she ate. Apis mellifica 1 m SOS, amelioration Kali Beach 1 m, at times dry cough SOS, Cantharis 1 m SOS, urine burning, weakness 3, coldness +3, dryness +3, thirst +3, all symptoms. Every day feeling more and more run down. Anxiety +3 of family nagging, SpO2 level not measured.
Totally confused. Therefore action, ये लो, वो लो, ये लो. That state of mind is important. दवाई लिया, जाने दो उसको, उसके साथ हम क्यों झगड़ा करेंगे. है तूने ऐसा किया, ये सब देखो. एक डॉक्टर ऐसा था हमारे यहाँ, पेशेंट ऐसा कुछ करता है तो बोलता है ये तुम्हारा वहाँ के इसलिए मेरी दवाई काम नहीं करती है. क्या है यार, तुम भी पेशेंट को क्यों इतना करते हो आप, यू नो. इसलिए मैं समझ गया कि उसका माइंड क्या है नाउ. कि ट्रिमेंडस एंग्जाइटी ऑफ द डिजीज एंड ऑफ द एनवायरनमेंट which makes her to take, and that speaks of her personality, you know. Go ahead.
25th May evening, breathless +2 on walking or talking. At night, amelioration gentle rubbing on back, throat swab done, all other complaints more intense, weakness +3, Kali Beach 1 m 1 or 2 doses, does not relieve till morning.
थ्रोट में आ गया अंदर तो काली बीच आ गया, swallowing difficulty. ये हम लोग है ना, वही प्रैक्टिस होती है हमारी कभी कभी, यू नो. पेशेंट का गले में जरा भी ऐसा कुछ दिखा, काली बीच, मर्क सॉल्व. राइट साइड है तो मर्क आया, लेफ्ट साइड है तो मर्क आया, ऐसा चलता ही रहता है सब, यू नो. या
26th May morning at 6:30 goes to center, came back by noon very much breathless, aggravation.
1 minute. 10 days have passed. Now you must keep that in mind. 10 days have passed. And the system is continuously expressing and expressing. Every time expressing much higher intense symptom. You know, that means body is trying to fight out in spite of all wrong medicines or whatever. You know, go ahead.
Came back by noon very much breathless, aggravation lying on back.
Now breathlessness started.
Contacted sir on phone. Prescription was phosphorus 1 m, SpO2 advice.
Now, you take the totality of from day 1 till today. Thirst increase, everything increase. इतनी चिली हो गई है, उसको पूरा उड़ के चाहिए. अगर सर खुला रखती तो शायद मैं आर्सेनिक सोचता था, लेकिन सर भी कवर है, एवरीथिंग इज सो मच कवर्ड अप. चिली हिपार्सल भी दे सकते थे आप. वाई नॉट हिपार्सल, कोई बोलेगा सर हिपार्सल क्यों नहीं दिया, लेकिन 10 दिन हो गए हैं. डेप्थ ऑफ द डिजीज इज टू मच नाउ. I cannot give such a drug where there is no depth. And on that basis, phosphorus was given to her. Everything considering her mind and everything. Right? Go ahead.
Better for some time, but aggravated at night 8 p.m. But to be on safer side, went to hospital, CT scan done, blood test relevant done immediately. SpO2 level minimum 92, pulse 88 by 100 reports attached.
Now these whole records are there, printed records are there, that I will show you later on. Go ahead.
Prescription hydrocortisone 10 mg IV injection once only.
हॉस्पिटल में गई तो ये चालू हो गया उसका. अब पूरा फॉस्फोरस के बाद अभी हाइड्रोकॉर्टिजोन वापस आया. You know. Go ahead.
Here, the disease picture is modified due to steroid. The true picture of the disease is not available. There is no much change in totality. Hence, the totality was framed from original and evolved symptoms.
Got it? Original and evolved totality. Day 1 से लेके आज तक. Go ahead.
Unmodified picture of the disease aphorism 91
Organon.
and 192.
Modified and unmodified picture of the disease. Right. In other words, susceptibility is still good, which is sustaining all the brunt of viral infection and not gone into any complication. आज कितना 10-15 दिन हो गया, you know. फिर उसके अंदर steroid आ गया. Go ahead.
Totality, psychotic miasm, gradual progress of the symptoms, evening aggravation, getting wet in hot
One
weather.
This is a disease infection, still psychotic miasm. Mind well, हम लोग सोचते हैं ना tubercular miasm होता है, infection होता है तो. But you see the march of events and the modalities and everything. Psychotic miasm, slow, gradual process. Go ahead.
Perspiration, aggravation, coldness, sleep amelioration, rest amelioration, gentle rubbing amelioration. Burning +3 all orifice.
एक मिनट पहले आओ. एक पहले. हाँ. ये जो gentle rubbing था ना, तो she used to get pain in the chest, I mean back, and her daughter used to press her and make her this thing. She never used to get sleep, so she asked her daughter to massage there, you know, and then that massage gradually gave her sleep. This is there in my data of the case, which is also there with me, the total data, you know, day wise sub hai. And whatever she has talked, and that is in audio also. One can hear that. Yeah. Yeah.
Burning +3 all orifices and general.
1 minute. She started having burning everywhere in the body. Burning, burning, burning. Carbon में भी है, phosphorus में भी है. There are so many burning drugs. Arsenic है, APs है, cantheris है. Burners, you know. Yeah.
Dryness +3 all orifices and general. Soreness +3 with pain. Aggravation any position. Weakness +3 aggravation lying, sleep, rest. Appetite normal in fever. Thirst unquenchable. Thirst large quantity and cold water.
Now this girl was so much homeopathic oriented. Steroid दिया तो उसको जैसा लगा कि उसके ऊपर कोई जुल्म किया है. तो वो हॉस्पिटल में थी. एक इंजेक्शन दिया उसको. दूसरा तीसरा टैबलेट देने का था. She did not take any tablet. मैं नहीं लगी. वैसा करके फेंक देती थी वो हॉस्पिटल के अंदर, you know. और मेरे पास से दवा, अभी मेरे पास से दवाई मंगाती है वो, मैं दवाई देता हूँ तो वहाँ हॉस्पिटल वाले देते नहीं है उसको. तो फिर उसने क्या किया, उसके हस्बैंड को बोला तुम खीसे में डाल के लाना, मैं यहाँ ले लूँगी, आप नीचे मत कुछ करो. तो दैट वे सीक्रेटली शी वॉज टेकिंग विदाउट नॉलेज ऑफ एनीबडी. दैट मच आई अप्रिशिएट कि कितना उसको होम्योपैथी पे विश्वास था. दैट इज़ मोर इम्पॉर्टेंट, यू सी. एंड शी इज़ ऑनेस्ट टू द सिस्टम, honest to her patient, you know. But because anxiety है तो कुछ wrong action ले लेती है. That is okay. Go ahead. And still phosphorus totality has not changed. Go ahead.
Profuse drenching perspiration in fever.
1 minute. And she used to say कि मैं जैसे बाइक में आती हूँ घर पे तो पसीना तो इतना होता है कि मेरे को as if I am drenched, बारिश में स्नान किया ऐसा पसीना आता है. तो चीलपन उतना है, पसीना भी उतना है. दिस इज इंपॉर्टेंट फॉर फीवर टोटलिटी. गो अहेड.
Perspiration debilitating. Coldness +3 getting wet with perspiration. Breathless aggravation lying on back. Amelioration reclined position left side. Sore burning pain in throat. Amelioration ice cream.
बेटर बाय आइसक्रीम. 4-5 आइसक्रीम में खा के गई. इतना बर्निंग, इतना शरीर के अंदर वो था. आइसक्रीम खाती हूँ मैं. अभी आप आइसक्रीम में आर्सेनिक भी आता है, तो आप कोल्ड लेंगे या आइसक्रीम लेंगे, ये इंपॉर्टेंट है. आइसक्रीम एज अ आइटम और आइसक्रीम एज अ थर्मल, दिस इज वेरी इंपॉर्टेंट. गो अहेड. या दिस वाज द सल्फर. तो आएगा. मेरे को डॉक्टर विश्वला के साथ एक बार बात हो गए थे तो हम लोग को हमारे डॉक्टर धवड़े है ना, बहुत स्ट्रिक्ट है. ये धवड़े नहीं, ये तो बेचारा बहुत अच्छा है, वो पहले वाला धवड़े. यू आर लक्की यू हैव नॉट सीन हिम, बट आई एम मोस्ट लक्की दैट आई हैव ऑल्सो लर्न फ्रॉम हिम. तो वो विश्वला बोलती है, किशोर यार ये क्या है, हम लोग को हमारे टाइम में कंप्यूटर नहीं था, एवरी केस वी हैड टू डू मैन्युअली, यू नो, वो सब ये लेके आओ. और डॉक्टर धवड़े हमको हाथ में 10 केस देते हैं और 10 रेपट्राइजेशन की शीट देते हैं. तो करने का और दोनों हम लोग दोनों बैठ के शेयर में करते हैं. वो भी एक बाजू बैठी है, मैं भी एक बाजू बैठा हूँ. किशोर कौन सा ड्रग आया तेरे को? मैं बोला सल्फर आया. यार मेरे को भी सल्फर आया. फिर दूसरा केस सब में सल्फर ही आता है. पहला ऑल रेपट्राइजेशन में सल्फर, लाइको, कल्केरिया, उसके अलावा कोई ड्रग ही नहीं आती है. और डॉक्टर कासट पीछे से अपने को डांडी मारते हैं, किशोर તમને લોકોને આવડતું નથી કેવી રીતે રેપટ્રાઇઝેશન કરવાનું. એન્ડ દેન હી ગીવ્સ અસ સિમ્પોઝિયમ વોલ્યુમ નંબર 2 and 5, D2 and D5 रेपट्राइजेशन पढ़ो. बट नाउ सल्फर इसमें भी आया, अभी क्या करने का, ये प्रॉब्लम है. गो अहेड. ये मैंने क्या किया, दो स्टूडेंट को मैंने बोला रेपट्राइजेशन करो, डॉक्टर्स को. तो दोनों ने अलग अलग अपनी ढंग से किया था. तो ये जो लड़की को फॉस्फोरस आया. गो अहेड.
27th May morning felt very fresh
नाउ दिस वाज माय एंट्री टू द पेशेंट. गो अहेड.
but weak, no appetite. Prescription hydrocortisone 400 BD, erythromycin 500 TDS. She took only one tablet of HCT, no antibiotic. She managed not only not to take allopathic medicine. Same evening, nausea and vomiting and hematemesis, but settled after some time.
क्या है? हाँ. Now your evening aggravation, and you can understand phosphorus क्यों आया था वो. Go ahead. ये रिपोर्ट है, सब खोल के देखेंगे, खुलता है. Anyway, go ahead. Go ahead. हाँ, this is the report. See, और ये क्या है, जरा पढ़ो तो. कोविड का इंटरप्रिटेशन.
Positive test for SARS-CoV-2 confirms the diagnosis of COVID-19.
Next. हाँ, 28 में.
28th or
Mind that
29th.
she did not undergo any other investigation after she was better. I told her कि बाबा for our confirmation क्या करने का, ये लोग वापस मेरे को ऐसा करेंगे. Go ahead.
Weakness persists but not like before. Appetite still very bad. Constipation, dryness, soreness, burning zero, coldness, perspiration, dry cough off and on but bearable. Sleep normal. Discharged on 29th May evening, asymptomatic.
Now, this is something weakness भी है, appetite इतनी अच्छी नहीं है, constipation भी ऐसा है. That means still we require drug to be given. You know. Go ahead.
30th May, phosphorus
Then
0,
I started 0 by 1. You know. Yeah.
0 by 1, diluted doses, QDS 2 days, appetite plus 3, stool emulsion, no dryness, thirst, and June 2nd, developed dry cough with thirst plus 2, constipation, aggravation night, takes long breath, sits with cough, pain in chest, bryonia 1M SOS, emulsion 3 in 2 days.
Appetite increase, no dryness, thirst no, normal. 2nd June में developed dry cough with constipation SQ. Aggravated, night, takes long breath, sits with cough, pain in chest. This totality was made, you know. Because now the whole picture of phosphorus is gone. And therefore, yeah, go ahead.
June 5th, dryness plus 3, skin, mouth, eyes, vagina itching. General condition, sulfur 1M 1 dose, thermal modality changed. Completely cured, remained isolated till June to avoid patient or relatives, did yoga and pranayam. Back on work, there is demand for her plasma.
There is demand for her plasma now. You see, that is a different issue, totally. You see. Now, आगे है कुछ कि खत्म हो गया? Observation, हाँ ये पढ़ो ना, please, this is important. Yeah.
Observations, patient is a very strong-willed, firm with strong conviction. Her anxiety was of relatives and family members who constantly taunting and labeling as non-obedient, obstinate. She got admitted as she did not want any complication of disease and in life.
Go ahead. Next.
a typical psychotic type of COVID. In the evolution of disease, psychotic miasm and strong will of the patient slowed down the natural pace and pathology of corona.
1 मिनट. So earlier इतना slow psychotic miasm था और patient का strong will is one of the criteria for prognosis of the patient that I have added in my this that also has to be considered. Yeah. So strong will और ये दोनों था, इसलिए psychotic miasm से उसका disease under control रहा, बहुत ज़्यादा बढ़ा नहीं, ज़्यादा कोई उसको वो आया नहीं, क्या बोलते हैं ग्लास सीन आता है ना वो एक्सरे में. हाँ, go ahead.
Disease process remained progressive under current till it reached its peak of going into full-fledged psychotic pathology of infection of lungs and spasm. In spite of taking both allopathic 10 mg steroid and 1-tab HCT and so many acute homeopathic medicines.
क्लोरोहाइड्रेट ना हाइड्रोक्लोरिन वो देते हैं ना क्विनिन HCT. हाँ. Yeah.
The susceptibility of patient was not tempered.
So in this case, it was not tempered in spite of all these things because strong will and psychotic miasm. So it was not much, susceptibility was not much tempered. थोड़ा एकदम modified नहीं हुआ तो on the contrary characteristic symptoms दिखाए उसने. Go ahead.
Sensitivity being high, patient received disease force as well as medicinal force equally. Fast symptomatic or acute treatment with homeopathy could relieve symptoms but could not touch the core or miasm of the disease. This resulted in to slow progress of disease process.
मतलब वो जो दवाई ली थी acute उसने, it did not work much. Go ahead.
Susceptibility high, strong and stable, neither tempered nor modified by any medicine.
Stable susceptibility आपको सीखना पड़ेगा. What is stable susceptibility? That you will have to, that I can take lecture later on. Yeah, go ahead.
Intensity of symptoms reduced after allopathic treatment, but modality remained same throughout.
In spite of allopathic treatment, modality remains same. Susceptibility is still maintained. Yeah.
Lastly, when exact similar force, phosphorus was applied to the recovery was very rapid. A different pattern of moderately severe corona due to psychotic miasm and willpower and partial similar remedy.
Yeah. Anything else? Yeah.
There is classical reversal of miasm from psychotic to SORA, phosphorus, bryonia, sulfur.
है ना, देखा ना आपने?
Till the susceptibility is not satisfied fully with exact simillimum at miasmatic pathology, symptomatic level and potency cure is not possible. 275 aphorism.
Yes, 275 पढ़ना अभी. हाँ, next. Okay. So this is, now you have chance to go for your lunch, but only 2 minutes, only 2 minutes. Wow. Now, हम लोग ये समझते दवा दिया सब खत्म हो गया. मैनेजमेंट में potency is very important, repetition is important, very important, and that will depend upon the response of the patient. You see, so please keep susceptibility, miasm together plus willpower into consideration and susceptibility of the patient to understand the prognosis. That is very important. Thank you very much.